Hi, my name is Karen Gastro, and I'm going to demonstrate the IV push skill for you today. The first thing you're going to do is compare your medication administration record to your physician order. I have an order for Mr. IV Fluids, hospital number 00546321, 00546321. He has no known drug allergies, His date of birth is 9/28/46, 9/28/46. He's in room 325. He has Dr. Jones Smith for a provider. And the reason he's getting the medication is for heart failure class 3 and stage 4 bipedal edema, as well as hypertension. Now I'm going to compare the physician order to the MAR. I have today's date, general diet, encourage ambulation, monitor INO, daily weight, capped IV. I have an order for Lasix, 20 milligrams IV stat. On my MAR, I have Lasix, 20 milligrams stat IV to be given now, today's date. I also have an order for inject 2 cc's 0.9% sodium chloride every 8 hours and PRN to maintain patency of the capped IV. And I have on the MAR today's date 0.9% normal saline, 2 mLs flush, PRN, IV. Now I'm going to do the 3 checks of the 5 rights. My first check, today's date, Lasix 20 milligrams stat IV now. In my hand I have for Mr. IV Fluids, Lasix 10 milligrams per ml. It expires next year. Because I have an order for 20 milligrams, I'll need to drop 2 mLs. First check on the Lasix is done. My first check on the sodium chloride is today's date for Mr. Fluids, 0.9% normal saline, 0.9% normal saline, 2 ml flush, PRN, IV. So my first check is done. Second check for Mr. IV Fluids, today's date, Lasix 20 milligrams stat IV, due now. In my hand I have Lasix 10 milligrams per ml. I will drop 2 mLs to equal 20 milligrams. Second check on the med is done. Second check on the sodium chloride. I have Mr. IV Fluids, today's date, 0.9% normal saline, 2 ml flush, PRN, IV. And I have 0.9% sodium chloride to be given IV for Mr. Fluids. Second check is complete. Now that I have finished comparing my physician order to my medication administration record, I am ready to wash my hands.
Go.
Now that I've washed my hands, it's time to gather my supplies. My supplies include Lasix 10 milligrams per ml, which expires next year. And I notice that the fluid is clear, there's no sediment, so it looks good to use. I also have my normal saline. It expires in 2018, and the fluid is also clear and looks good to use. I will also need 3 ml syringes, 3 blunt cannulas, a stack of alcohol wipes, some tape to label my syringes with, as well as some clean gloves. So I have my Lasix 10 milligrams per ml, which expires next year, and I notice that the vial is clear and there are no particles floating in it, so it looks good to use. I also have normal saline, 0.9%. It expires in November of 2018. And the fluid is nice and clear in this vial as well. I also need my 3 blunt cannulas, my 3 ml syringes, and a stack of alcohol wipes, as well as some clean gloves for the procedure. I've already prepared 2 labels for the 2 mLs of 0.9 normal saline. Now I can prepare my label for the Lasix. So I'm going to write Lasix. My dose is 20 milligrams, and I'm drawing up 2 mLs from that 10 milligram vial. Now I'm going to add 2 mLs of air to my syringe. And then I'm going to add it to my vial, air to air. And then I'm going to drop my 2 mLs of Lasix here. And use the scoop method to recap your IV. And then I'm going to... Now I can drop my saline. So I'm going to clean the port. And you need to clean the port every time that you enter it. Then I'm going to add 2 mLs of air to my syringe for my saline flush. Air to air again. And I'm going to draw my 2 milliliters of air from the vial of saline. And I'm going to label it with my saline tape. I'm going to drop my 2 mLs of air. Put the air in the vial, air to air. Drop my 2 milliliters of saline. And then I'm going to label my saline with the tape that I've prepared earlier. Okay, now I'm ready to do my 3rd check. I have Mr. IV fluid, today's date, Lasix 20 milligrams, stat IV now. I have prepared Lasix 20 milligrams, 2 mLs from a vial of Lasix 10 milligrams per ml. I'm doing my 3rd check on the saline. I have Mr. IV fluids, today's date, 0.9% normal saline, 2 ml flush, PRN, IV. I have my 0.9% normal saline vial, and I drew up 2 syringes with 2 mLs of normal saline. Now I'll check my note card to review information about the medication, and then I will get my supplies and go into the room. Now I'm going to enter the room with my supplies. Hello, Mr. Fluids. My name is Karen. I'm going to be your nurse today. Your doctor has ordered a dose of Lasix for you. It's to help you with the swelling in your ankles, and it's also going to help bring down your blood pressure. But first, I need to check your name and verify it with the medication administration record. Okay, Mr. Fluids, could you please verify your name and date of birth? Please spell your last name.
Fluids.
Okay, and please verify your date of birth.
9/28/46.
Okay, that checks out. Thank you.